My name's Janet Hayden and I'm a clinical nurse specialist, and I've been working at King's College Hospital for the past 7 years. My role is to look after patients with a group of bone marrow disorders, including myelodysplastic syndrome, and to coordinate their care whilst they're here. Usually patients are very fearful when they've been given a diagnosis of myelodysplastic syndrome, as it is a serious bone marrow disorder, but it can be diagnosed at all different stages, and some patients may come to us who are at very early stages, and you need to be able to give them lots of reassurance that their disease may be very stable for a very long period of time. And you help them to come to terms with that, really, and give them a lot of psychological support. And then the other end of the spectrum is you've got patients that have got much more aggressive disease and need much more intensive treatments, and obviously that can be very scary for patients and their families. The symptoms that patients have are generally as a result of their bone marrow failure, so they can be very anemic, requiring lots of blood transfusions, so that causes fatigue and shortness of breath. They also may have very low white cell count, which means that their immune system is very low and they're very susceptible to infections. And some patients have persistent infections, are in and out of hospital quite a lot. And some patients have problems with bleeding as well, so need to come into hospital for lots of platelet transfusions. They have problems with bruising and bleeding on a daily basis, and this can be quite distressing. The older patients are, the more likely they are to have other comorbidities, which will mean that their performance status may not be as good as it was when they were younger. So they may have other exacerbating factors, cardiac problems, etc., which may make managing but the bone marrow problem more difficult. Once patients are on a transfusion programme, then generally they will stay on transfusions until such times as we can give them a treatment which may improve their bone marrow function. And there are certain treatments such as hormone replacement, which can stimulate the bone marrow, and other drug therapies which can reduce transfusion requirement. But these drugs often only have a temporary effect if they work at all, and patients end up back on transfusions once they are no longer effective. Transfusions can vary from individual to individual in terms of how frequently they may require it. Some patients require it for 1 to 2 weekly, others it may be monthly or longer. One of the major challenges that faces us now is being able to access some of the drugs that we need, to get funding for some of the drugs that we need to be able to treat the patients that we think might benefit from them, and to educate our colleagues about MDS, so our GPs or and other doctors about what MDS is and what that impact and the impact of it on the patient.